Hello everyone. Today we'll discuss cardiopulmonary resuscitation, CPR, one of the most important life-saving skills in emergency medicine. CPR is an emergency procedure performed when a person's heart stops beating effectively or they stop breathing normally. The goal is to maintain blood flow to vital organs, especially the brain and heart, until advanced medical care arrives. Learning objectives. By the end of this lecture, you should be able to define CPR, identify when CPR is needed, describe the steps of adult CPR, understand the role of an AED, recognize common mistakes during CPR, understand special considerations for children and infants. What is cardiac arrest? Cardiac arrest occurs when the heart suddenly stops pumping blood effectively. Signs of cardiac arrest: sudden collapse, unresponsiveness, no normal breathing or only gasping, no signs of circulation. Without treatment, brain damage can begin within 4 to 6 minutes. Cardiac arrest is a leading cause of death worldwide. When the heart suddenly stops pumping blood effectively, oxygen can no longer reach the brain and other vital organs. Without immediate intervention, irreversible brain damage can occur within 4 to 6 minutes, and death may follow shortly afterward. CPR is a simple yet powerful life-saving skill that anyone can learn. Prompt and effective CPR can double or even triple a person's chance of survival while waiting for emergency medical services. Cardiopulmonary resuscitation, CPR, is an emergency procedure that combines chest compressions and rescue breaths to maintain circulation and oxygen delivery when a person's heart has stopped beating or they are not breathing normally. Purpose of CPR: maintain blood flow to vital organs, deliver oxygen to the lungs and bloodstream, delay brain injury, increase the chance of successful resuscitation when advanced medical care arrives. What is CPR? CPR does not usually restart the heart by itself. Rather, it keeps the body alive until definitive treatment, such as defibrillation or advanced cardiac life support, can be provided. When is CPR needed? CPR should be started immediately if a person is unresponsive, does not respond to verbal commands, does not react when gently tapped on the shoulders, is not breathing normally, no breathing at all, only gasping or irregular breaths, agonal breathing, has no signs of circulation, no purposeful movement, no signs of consciousness. Examples: sudden cardiac arrest, drowning incidents, electric shock injuries, drug overdose, severe trauma resulting in cardiac arrest. Adult CPR, the CAB approach. Modern CPR follows the CAB sequence: C. Circulation, chest compressions. A. Airway. B. Breathing. This sequence prioritizes chest compressions because maintaining circulation is critical. Step 1. Ensure scene safety. Before approaching the victim, check for hazards such as traffic, fire, electricity, or unsafe surroundings. Ensure your safety and the victim's safety. Remember, a rescuer who becomes injured cannot help others. Step 2. Check responsiveness. Tap the person's shoulders. Ask loudly, "Are you okay?" If there is no response, call for help. Activate emergency medical services. Step 3. Call emergency services and get an AED. Call emergency services immediately. Ask a bystander to bring an AED if available. Early activation of emergency response is a crucial link in the chain of survival. Step 4. Begin chest compressions. Hand position. Place the heel of one hand on the center of the chest. Place the second hand on top. Interlock fingers. Compression technique. Keep arms straight. Position shoulders directly above hands. Compress the chest forcefully. Compression standards. Depth: 5 to 6 centimeters, 2 to 2.4 inches. Rate: 100 to 120 compressions per minute. Allow complete chest recoil. Minimize interruptions. A helpful rhythm is the beat of songs with approximately 100 to 120 beats per minute. Step 5. Open the airway. Use the head tilt, chin lift technique. Tilt the head backward. Lift the chin upward. This helps keep the airway open and allows effective ventilation. Step 6. Give rescue breaths. After 30 compressions, pinch the nose close. Create a seal over the mouth. Give 2 breaths. Each breath should last approximately 1 second. Cause visible chest rise. Continue CPR using a ratio of 30 compressions, 2 breaths. Hands-only CPR. For untrained rescuers, call emergency services. Perform continuous chest compressions. Do not stop until professional help arrives or the victim recovers. Research shows that hands-only CPR can be highly effective for sudden cardiac arrest in adults. The role of an AED. An automated external defibrillator, AED, is a portable device designed to analyze heart rhythms and deliver a shock when necessary. Why is an AED important? Many cardiac arrests occur due to abnormal heart rhythms such as ventricular fibrillation. An AED can detect shockable rhythms, deliver electrical therapy, improve survival rates significantly. How to use an AED. Turn on the device. Follow voice prompts. Attach electrode pads to the bare chest. Ensure nobody touches the victim during analysis. Deliver a shock if advised. Resume CPR immediately after the shock. AEDs are designed for public use and can be safely operated by trained and untrained rescuers. Common mistakes during CPR. Even well-intentioned rescuers may make errors. 1. Compressing too slowly reduces blood flow. 2. Compressing too shallowly fails to circulate blood effectively. 3. Not allowing full chest recoil prevents the heart from refilling. 4. Frequent interruptions reduces CPR effectiveness. 5. Incorrect hand placement may decrease compression quality. 6. Excessive ventilation can reduce blood return to the heart. 7. Delayed CPR initiation. Every minute without CPR decreases survival chances. Special considerations for children and infants. Children and infants require modified CPR techniques because of their smaller body size and different causes of cardiac arrest. CPR for children, 1 year to puberty, compression depth. Approximately 1/3 of chest depth. About 5 centimeters, 2 inches. Hand position, 1 or 2 hands depending on the child's size. Compression to breath ratio, single rescuer, 30 to 2. 2 rescuers, 15 to 2. CPR for infants, under 1 year, compression technique. Use 2 fingers for a single rescuer. Use the 2-thumb encircling technique when 2 rescuers are present. Compression depth, approximately 4 centimeters, 1.5 inches. About 1/3 of chest depth. Rescue breaths. Cover both the mouth and nose with your mouth. Deliver gentle breaths. When to stop CPR. Continue CPR until the person shows signs of life. An AED instructs otherwise. Qualified medical personnel take over. The scene becomes unsafe. You become physically unable to continue. Summary. CPR is a critical life-saving skill that can preserve life during cardiac arrest. Rapid recognition of an emergency, immediate chest compressions, early use of an AED, and high-quality CPR significantly improve survival outcomes. Understanding age-specific modifications and avoiding common mistakes ensures that CPR is performed effectively and safely. Key take-home message. Recognize the emergency right-pointing arrow. Call for help. Right-pointing arrow. Start high-quality CPR. Right-pointing arrow. Use an AED as soon as possible. Right-pointing arrow. Continue until professional help arrives. Reach out for any questions.